Good morning. So we're really excited about this panel today. I am going to introduce my esteemed panelists, but first I want everybody to get in the right mindset and the right framing for today's conversation. So, somewhere right now there's someone awake at night worrying about a symptom. It might be a lump that they found in the shower. It might be a nasty cold they can't kick. It might be that they're a caregiver and they're worrying about a diaper rash on a baby that won't go away. I personally have been there. It's the middle of the night, so they know they need to see a doctor, and they will. But for now, they pick up their phone and they ask ChatGPT about the symptom. They Google, and maybe they scroll on a community like Reddit to try and understand and get some reassurance and maybe a little hope. So, I want to get a show of hands in the room of who here has used AI to answer a health question. Okay, now keep your hands up if you've gone on Reddit to answer a health question. Yeah, still a lot of hands. And so what I think is most interesting about that is that the health journey of information is really changing and converging between community and AI and technology, all before people even make it to the exam room. And so that's what we're here today to talk about. All of these ladies are experts in their own right, so we'll start with a round of intros and then we'll get into the conversation. To start, my name is Mary James. I lead advanced analytics at Real Chemistry. We are a marketing and communications organization focused on the intersection of technology and health, and most importantly, getting the right information to the audiences that need it at the right time, like patients, caregivers, and physicians. Alex?
All right, glad to be here today. I wanted to give a heartfelt thank you to anyone in the audience who happens to make beta blockers, because I would not be here otherwise, and I really appreciate it. So my name's Alex Bell, and I'm here as a patient advocate. I ran the subreddit for breast cancer for 5 years, in addition to starting the Do I Have Breast Cancer subreddit. And when I was 32 years old, I was diagnosed with stage 3 breast cancer. I had just moved to New York. I didn't have a lot of community, and I leaned very heavily on Reddit. And about a year later, they put a call out for moderators, and honestly, it changed my life. And I've learned so much about how patients approach healthcare and medical decisions that I'm happy to share those teachings with you today.
Ania?
Hi, good morning, everyone. My name is Dr. Ania Bilski. I'm an emergency room physician. I practice at UCSF and Kaiser in San Francisco. I'm also the VP of Clinical AI at OpenEvidence. I'm not sure how many people here are familiar with OpenEvidence. Awesome. Do we have any doctors in the room? Shout out. So OpenEvidence is like the leading medical information platform in the United States. It's used by almost 50% of doctors currently. So super excited to be here today to talk about trust in health in the age of AI.
Hi everyone, I'm Jessica Calef. I'm the Industry Director over Health at Reddit, and so thrilled to be here with you all.
Great. Well, let's start by talking about the way the health journey is changing. So, Jessica, starting with you, how and why are people coming to Reddit for community around their health information?
It's a great question, and what you said earlier about accessibility, I think that hits right on why we're seeing so many people flock to health to understand their flock to Reddit to understand their health information. As we know, AI is disrupting everything. It's disrupting the way that people are searching for health information. It's hard to get a doctor's appointment. It takes months in some cases to understand, what even would be the first step in seeking some kind of treatment. More and more users are coming to Reddit in a variety of ways. Maybe they're going directly to Reddit because they understand the platform. Maybe they're finding us, has anyone here ever done a search and then appended their search query with Reddit to get really specific information, right? We're seeing a ton of people come in that way. And of course, through LLMs, a lot of the Reddit and the human-fueled information is coming through in LLMs. But the reason that people are really coming to Reddit for health information is because of the foundation. It is a platform that's over 20 years. We have over 20 years of conversations. And the platform is organized by interests and communities. We have over 100,000 communities and close to 1,000 health-specific communities. Every single user is anonymous. So you can imagine, you go to the platform, you're not Jessica, you're user XYZ. So you are going to enter a conversation maybe about eczema. And when you're in this subreddit dedicated only to eczema, you're surrounded by like-minded strangers who know a ton about eczema, because why would you be in that community if you don't care deeply about it, or if someone near to you doesn't suffer from it? So you're surrounded by like-minded strangers, and you're able to ask any kind of question. We are moderated by people like Alex, who care deeply about whatever the topic is, and they're there they create the community, they set clear rules for engagement within the community, and then they enforce those rules. So if someone is in the community and they're asking a health question that is completely off topic, users within the community are going to downvote it, no one will even see it, or the moderators won't allow it to go live at all. And there are no paid influencers. I know there's so much talk always about paid influencers, but on Reddit, that doesn't exist. You actually get credit for bringing value to the community. We have our own currency called karma, and you get more karma the more value you bring. So the only reason people post is because it feels good, which is pretty wild. So it's a very, very positive space. So to answer your question, it's a safe haven for health information. You're surrounded by people who know a ton about the topic, and we find that it really is just supportive and provides so much guidance for patients, for caregivers, or for HCPs.
Yeah, that's great. And Alex, maybe you can expand on it being a safe haven, and why do patients flock to Reddit? What's the experience like, and what are they getting there that they might not get from traditional health media or from the exam room at all?
Right. So just to build on what Jess was saying, the medium of communication with something like Reddit is categorically different than other ways that we communicate with each other. It's anonymous, it's long-form text, and again, topic-based, so you're all kind of in the same space. People really open up about their concerns, their fears, their health. A lot of the times we don't want to talk to our sister or our mom or our friends, and they might not know what we're going through. Getting a breast cancer diagnosis when you're 32 years old, like none of my friends knew what that was like. They couldn't give me advice. And every case is so complicated that you need personalized advice. With the scale of Reddit, there's a good chance that there's someone on there in your same situation with your same hobbies that you are trying to maintain. The example I like to give is, a woman who was a big crocheter, and she was worried about neuropathy in her hands. And she's able to talk to another cancer survivor who loves to crochet and says, why don't you try these needles? I don't crochet, so I don't know what they're called. But doctors can't always answer questions like that, or they don't feel important enough to ask your doctor. You only have 15 minutes in there, you kind of rush through it a little bit. So I think that vulnerability and that emotional support for small things, things we don't always want to bother our friends for, that makes Reddit really special.
Yeah, that sounds really special. Where have you seen it go sideways, or where have you seen people get stuck when it comes to community, like doom scrolling or delaying care?
Well, I would say with the topic-based forums, you don't doom scroll so much because it's not just a constant dopamine hit, it's more detailed. I would say people really get stuck with the sheer volume of decisions you have to make. It floored me, the amount of choices I had as a patient. The doctors will give you 3 or 4 options that all have the same survivability, and it's up to you to decide for yourself. I lost my train of thought because I'm nervous.
Oh, but you're doing great.
Alex, So Alex and I, we were on a panel relating to. No, you're incredible. Your stories are so amazing. I'm just going to keep repeating your stories. But we were on a panel about breast cancer. You were with a colleague of ours who's a patient, who's in remission. And what she was saying that within the communities, sure, things could go sideways and people could spin out, but actually the communities are there to support you and write you. And my colleague said that the most interesting thing is that the empowerment, it comes through. People are nervous to get second opinions. They're nervous to tell their doctors, I'm not sure if that's right. They don't want to, and you probably could speak to this, but, they maybe are not confident in the decisions they're making, just like you're saying. And the communities are there almost like a rallying of support to say, you know what, it's okay. You can ask for this, you can ask for that. Go in and have a list of questions that you want to make sure you get through because you only have the 15 minutes. So I actually think if you're not sure and you're going into these communities, they're going to help guide you in whatever way is best.
Totally. I do want to get the doctor's
Yes.
the doctor's point in the room. So Ania, people are coming into your ER with this information that they got from AI, they got from Reddit, right? Sometimes they're on their phone while you're trying to examine them, right? Trying to get the other opinions. What is good and what are some good conclusions? And then what are some maybe not so good conclusions when that happens in the exam room with you?
I think this is great. I think this might be, not all physicians would agree with this, but I actually love when patients have researched things and looked things up online using ChatGPT or Claude or whatever. I think it empowers them to ask better questions, right? So much of my job is detective work. So as an ER physician, I am just solving puzzles all day. People are coming to me with, a cluster of symptoms and a story, and I have to kind of decipher what that can mean and what their diagnosis might be. And so the better they're able to piece together that story, the better they're able to tell me granular details, the better I'm able to help them. And so I think, to be their own advocate, I think being the best informed they can possibly be is only for the better and only provides a better visit overall.
Yeah, totally agree. So let's turn to trust itself, right? So that was a bit about the journey that we're living with today. But when it comes to trusting content, so Alex, what makes one comment more trustworthy over another?
Ooh, I don't know if I'd phrase it quite like that. I'd say when it comes to misinformation, it's really the emotions that are driving people who are willing to absorb that information. So the community helps treat the fear that fuels why someone would want to, go to a hyperbaric oxygen, chamber instead of chemo or something that's proven to work. So I think the community can be really good about addressing the reality that someone's going through and kind of making them think through. These are the choices I actually have in front of me, which are hard to accept. But I think with the how do you look at one comment or the other? In a practical way, we look for commercial interests. We look for aligned incentives. Is the person who they say they are? And most of the time, are they actually a cancer patient? Because within our community, it's almost all patients. We do allow caregivers to pop in and ask really specific questions for somebody. But otherwise, you can tell pretty easily if they know what they're talking about with cancer or not. And that's the big we look for.
Right, okay. And so Jessica, you talked about no paid influencers on the platform, but what about signals of credentials, signals of trust?
Yes, that's a great question. We have tons of specialized subreddits for oncologists, for anesthesiologists. We even have a community. We have many communities, but we have one in particular that has both patients and HCPs in one subreddit called r/AskDocs. And in that community, every single user has to provide their FLAIR, which is their medical license, in order to engage, period. But I will say, Redditors are wild. We once had, someone was chiming in about the board certification that they had, and it was, a bio. And the Redditors were sniffed it out. They're that is outdated. So really, these people are here, like you were saying earlier, they're not mindlessly scrolling. They're there to read every detail, every piece of information They are there for like the data. It's a totally different platform than some of the other social platforms. Like the details are crucial, and it's the coolest thing that in the health space that the celebrities within Reddit Health are the scientists who make the treatments. So it's such an awesome place because I think there's a lot of credit to the doctors, to the academics, to the scientists, and everything has to be sourced. So to answer your question, you make sure that your license is up to date, otherwise they'll know.
Yeah, so crowdsourced trust, like
The moderators will double check. You have to literally
yeah,
put in your medical license, but there also is a lot of crowdsourced
yeah,
trust.
that's amazing. Where we don't have crowdsourced trust today, I think, is AI. So Ania, if a patient comes to you and they have AI generated information, right? Like what would be the trust label you would want to see on AI generated information?
Oh man, okay, in an ideal world, I would love to see transparency of sources, right? So where is information coming from? A blog is not the same as like the Mayo Clinic publishing, data. So if every piece of information online, especially medically related, could have transparency of source, number one. I think two, if then we could qualify basically the quality of that source, right? So for OpenEvidence, everything that we source are all the highest peer-reviewed medical journals kind of in the country. And even amongst those kind of tiers of evidence, there's different levels of quality, right? So a case study is very different than a randomized control trial. And so if we could have the quality of sources also outlined online for patients, that would be ideal. And then I think the third component would be generalizability. So how generalizable does this pertain to me as a patient? Was this study actually studied in people like myself? I think those three aspects. And then any risk of bias, especially with medical information out there. And there's a lot of conflicting medical information, so it's tough to know what to trust, right?
Yeah, and you know what I realized? We didn't really go into what OpenEvidence is and what you do. So maybe you could tell the audience a little bit about OpenEvidence.
Yeah, so I saw a few people knew what OpenEvidence is. We're super excited. It's just a really fun time to practice medicine right now. We are basically like the leading AI tool that physicians are using across the country, where, at least for me in the ER and all my colleagues who use it, we can ask it any question, any complicated, nuanced clinical question, and it can provide just a really thorough, high quality backed answer. And every single response, that every part of the answer it's linked directly to a citation. And so we can go back and actually, okay, what paper was this written in? And what quality of paper is this? What impact journal does this have? And so for physicians, it's become a really trusted source. It's grown entirely by word of mouth. So we're at 50% of doctors in the country using it. So I guarantee probably all of your physicians are using it, maybe without you guys knowing. And then interestingly, I think just last week we crossed 1 million questions a day. So doctors are asking over 1 million questions a day on the platform.
Wow.
It's growing rapidly, yeah.
That's amazing. That's amazing. So let's turn a little bit and we've talked about trust. Let's talk a little bit about misinformation. So Jessica, and Alex, this is for both of you, but tell us about the role moderators play now, especially with the advent of AI-generated information. What's the importance there? And then Alex, I'd love to hear more about the experience of moderating and what that sort of looks like.
So I stopped moderating last June, and already things have changed dramatically. When I was still on there before I decided to pass the torch, it was pretty obvious what the AI bots were. They have a certain cadence. Yeah, I'm nervous for when they get better and better, because historically it's been pretty easy to just remove the content, and Reddit's filters pick up a lot of it, which makes our job much easier. It's a lot faster to go through a queue when it's already been pre-sorted. Did you have anything on that part, Jessica?
I was just going to say that Reddit's job is to make the lives of moderators easier, right? So like you're saying, we have machine learning in place to help control for that, but we just try to make it as simple as we can for moderators to be able to honestly guide productive conversations. That's the entire point, and that's why, Reddit has been thriving for so many years.
Yeah, makes sense. Will you tell the audience a little bit about what a day in the life as a moderator looks like?
Yeah, so moderators have a queue that they work from of posts, comments that people have submitted, and some of them go live automatically, some don't. So every morning I would wake up, clear the queue, see what happened the night before. We respond to mod mail messages, which could be inquiries from research requests or patients that have questions or users that are upset about something that happened in that space. And usually I check my phone, I want to say like 15 times a day to clear that queue out. So I was on there every day for 5 years straight. And we also spend time usually like on the weekends or, because we're all working and cancer patients, to work on like the rules and the culture and some of the higher level stuff. We always need to adjust the rules over time based on the feedback that we're getting from the community. And when I first took over, we noticed there was a huge issue with pre-diagnosis posts. So patients who were really scared that they might have cancer, but it's not really the appropriate place to ask the people who are already battling cancer to relieve your anxiety on that. They need support though too. So we created the sister sub, the Do I Have Breast Cancer, to funnel those patients over. And it took a little while for it to gain momentum, but it's very active now too. And that's just an example of something that like the moderators will step in and take care of to dramatically improve the culture of that space.
Yeah, I think one of the things I'm picking up on from this conversation is the community really helps with sort of the emotionality around the experience. And Ania, it's a little off script, but we were talking last night about how, when you're practicing in the ER, like does anyone watch The Pit? Yeah. Okay. So does Ania, it turns out.
It's good. It's realistic, but it's a little extreme. We don't get
Yeah. But we were talking about how, when you're practicing, you also have a lot going on and you're processing a lot too. And so, this is a bit of a twofer, but what sorts of tools are there that help you manage, or like what sorts of AI tools are helping reduce your burden or supporting the emotionality of your work when you're practicing?
Yeah, I think this is interesting. I think this is where AI will really benefit, physicians. We're humans, right? And so at the end of a 12-hour shift, I'm so tired. Like when I've seen my 20th patient and you want to give every single person your 100, all of your attention, and because they deserve that. They're there, and this is the hardest moment of their day. This is the hardest moment of their month, likely, maybe of their life. And so sometimes I can't even give 100% of myself. And so I think that's where AI will really be beneficial, is just helping support us as doctors, right, as humans. I think so. More specifically, what tools that we're using actively, kind of in clinical practice. The first is clinical decision support tools, right? So OpenEvidence, I'm biased, but things like that where we'll reference like questions and have answers. And then I think the next one is ambient scribes. I think a lot of people probably have heard of this, but these are just like generative AI tools that it records on your phone like a clinical conversation, and then I don't have to go back and transcribe an entire visit. So previously I would have to literally go talk to a patient, run back to my desk, and then like quickly transcribe into a microphone everything they just told me, which just sounds,
That's
I know,
crazy.
It's a lot. And then you don't want to forget any details because the importance of clinical documentation and, med legal. So now it's like I press play on my phone, it records the entire conversation. We tell the patient, of course, we disclose that it's being recorded. And then everything is copied kind of directly into Epic, into our EMR. So that's just been practice altering.
Yeah, that's amazing. So thinking about some of those more urgent situations, you're always seeing people in urgent situations. What about, Alex, when you are moderating and there is something where someone is either in a crisis or maybe they're delaying care? How do you as a moderator handle that?
So the community really steps up and they handle it. I would, of course, contribute, but that's the wonderful thing about the self-correcting community. So one example I can give you, there was a user, we had a very similar medical background. She had a mastectomy, cancer spread to lymph nodes, means you have to remove most of the lymph nodes, and now like my left arm and her left arm cannot drain infection. So if there's any sort of injury, it's very dangerous. And this woman posted that her left hand was swollen, tender, and red and was getting worse, but she did not want to go to the doctor. She didn't want to go to the ER. She's like, I'll be fine, it's fine. You know, it's late, I don't want to wake up my sister. And then you have a community saying, you got to wake up your sister. Like, it's time to go. You know, you need your babysitter, I think was the reason. And sometimes we're in a little bit of denial, and in that moment we might call mom, but mom will always say go to the ER. And we don't always trust it. So when you hear it from strangers, you think, you know what, they're right, this is an urgent situation. So she did go to the hospital and updated us. They admitted her, she was on IV antibiotics for a serious infection that could have been life-threatening.
That's amazing. Good for the community. So thinking about also the future, right, and creating some transparency and creating some more trust. Ania, you talked about the different tools, right? How do you see, you know, the world of the clinician evolving as AI sort of takes over some of the tools, and you have shorter time than ever with patients, and you want to respect that dignity? How do you see that changing?
I think that doctors have to always stay in the pilot seat. I think that's important. I think a lot of people think that AI is going to take over and you'll just see robots when you go into the ER, and you know, it's never going to be that human element. And so I think, yeah, doctors really staying in the pilot seat, you know, flying the plane, but then it's really in conjunction with all these with these AI tools that are kind of helping us just practice better and be better physicians overall. So I think that's kind of the future. You know, I think also there's going to be this component of like the human last mile where, you know, we're really good at having those hard conversations, those goals of care conversations with patients and families, you know, disclosing a difficult diagnosis. And so that's really where like humans are going to flourish sort of in this next phase of practicing.
Yeah, I love that. And Alex, what do you think the future looks like? What would you like clinicians or organizations, there's plenty of healthcare organizations in our audience, to know and to be thinking about when it comes to the care of patients in this new information age?
Bluntly, I'd like to promote these communities more. I think a lot of people are sleeping on them and don't quite understand why they're so impactful. I think we have social media for all the wrong reasons. It shouldn't be for showing off your kitchen remodel to strangers to make them jealous. It should be opening up about your deepest needs and vulnerabilities to people who don't know you in real life. So you can speak up. So I'm thankful for anyone who's listening here today. If you know, maybe take a look. Like, if you went through something difficult in your life, maybe it wasn't cancer, it could have been, you know, divorce, loss. If you need support, go to these communities. And if you've been through something like that, you're on the other side, it is incredibly healing to help other people go through what you went through. And I think that, sorry, I'm pausing because I'm trying to like nail this part, the emotional plea to the audience. I think people need to understand how easy Reddit is. Yeah. It takes 30 seconds on your couch in your pajamas to say something nice to someone online, and you will feel better because of it.
Honestly, I use Reddit as a doctor about my own medical questions sometimes.
And it's heard it here.
No, it's so unique in that you're right. Like, people are anonymously saying things that are just so helpful and niche. You know, it's so niche. Like, you can literally think of any question, and Reddit will have asked that question. And so I love that point.
I think we keep coming back to the human aspect. That's something that we're all obviously craving in this new world, right? And I think the online communities, what they're doing is showcasing that everyone is a human. Your doctors are humans. And actually, if you're a marketer and you're trying to reach them, you can go. They are public facing. It's like a diary into what these doctors, nurses are thinking. R/Nursing has over 1 million nurses in the community. If you're wondering how to help them, how to support them, how to get through to them, like, that is where you can go. What's so wild is that anyone can read about what someone with breast cancer is going through. If you have someone in your life and you are not sure how to connect with them or support them, like, it's there to read. And I agree with everything that you're saying. Like, we just need more visibility. The audiences in these online communities are very clearly raising their hand and saying, this is what I'm dealing with and I need more support. We're seeing unbelievable growth in like communities like women's health conditions. Endometriosis has over 230,000 visitors a week. probably one of the most understudied women's conditions, misunderstood. And I think the fact that these people are raising their hand and saying, I am interested, I'm here to speak up and learn more, should showcase to every single marketer like what the needs are. And that's across caregivers, across patients, across HCPs.
Yeah, totally. I think physicians, clearly there's a gap in how we're communicating with our patients. And like if people feel the need to turn to online sources and instead of asking their doctor, that's also saying a lot.
Right, they're accessible. You could go there right now. You could be sitting here in the audience and you can be engaging with an online community right now. It's so easy.
I don't think I have a better closing than that. So, well, thank you. Thanks everyone for being here, and thank you, panel.
Thank you.